So the idea of the sensory room really came about several years ago when we started seeing patients in recovery that we kept seeing over and over again that they were having just difficulty integrating their sensory system and the input that they're getting in recovery without the use of the substance that they had been using prior to coming in here. It's a great fit for Recovery Ways because it's a very holistic way of working with the patient. I like to think of it as another tool in their kit for sobriety. This room is super saturated with sensory input. 7 out of 8 senses. The only one we're not dealing with in this room is taste. All the other senses are addressed in this room. Basically giving the patient and helping them be really saturated with sensory input, shift more neurologically calm, or vice versa, if the patient's really low level of alertness, really lethargic, you can shift towards more alerting activities, which helps bring their neurologic level of alertness up, and they are able to better focus on the task at hand. And then the room is about movement. I mean, I'm sitting still in this room right now for the interview. I never sit still in this room. We're moving with the patients in this room. We're sitting in different areas of the room. We're empowering them to pick an area based on how stimulating they want it to be or not want it to be. The different equipment in the room is to give input into the joints, which is another input, or to give some vestibular input, which is our equilibrium. So we have the swing, we have the chair that spins, and they get to pick and they get to play. And so there is an element of play, and it's really cool to watch the patients when you say, we're gonna play in this room. They're like, huh? You know, and teaching them that there's healthy play that don't involve the use of substances. And so I always say if we're sitting still in this room, we're not using the room correctly. During rehab, a patient's schedule is very scheduled from the time they wake up to the time they go to bed. And what we found is that most patients leave here 30 to 45 days later not returning to that same sort of schedule. From feedback from alumni and from looking at different studies, we found that that was an area that we could work with them while they're in rehab in the sensory room to talk about things like that. When you leave here, what is your day going to look like? What's your schedule like? What kind of body-based stress management techniques are you going to use when you're feeling triggered by whatever it is you're feeling triggered by? For whatever therapy you're doing, as an adjunct to that therapy, as a way to provide neurologic calm and to empower patients that they can also do that even when they're not in the sensory room. Because what they learn are these body-based stress management techniques, and they take those with them when they leave the sensory room. The research in the room is that you can alter a patient's level of alertness through the use of sensory input. Based on where their neurologic level is, they get to help pick the color of the lights. They get to pick the smell that comes into the room through the diffuser and the essential oils. They get to pick the colors of the effect lighting. They get to pick where to sit, what equipment to use. A lot of the work they're doing with a therapist is what we call top-down, so it's mind-to-body connection, and that's so important in recovery. They're doing step work and they're doing process work. And then we are doing kind of how I look at it as the opposite, again, another adjunct to their therapy, which is bottom-up, so it's body to mind. And it's just another tool for them to maintain sobriety because it's really, so many of the patients just aren't comfortable in their skin anymore. And also getting to know that they can trust their body and their body's instincts without the use of substances is a whole new space, or a space often forgotten by patients that have been struggling with substance abuse for a long time.